Hey guys, I'm Maddie and I'm a registered nurse. Today I'm going to teach you guys how to do an insulin injection. Insulin is measured in units and this is that 100 unit syringe. So this 100 unit insulin syringe is equivalent to 1 ml. So insulin injections are a subcutaneous injection, and what that means is we are injecting it into the fat layer of the skin. So when you go and you get your vaccines like a flu shot, that is an IM or an intramuscular shot. So for the insulin, we are going into the subcutaneous layer, the fat layer of the skin. Some common areas that you will see insulin injected could be in the stomach area, but you want to make sure you're going at least 2 inches away from the belly button, and you want to rotate sides every 4 to 6 times in order to prevent tissue necrosis, also known as tissue death. Insulin can also be injected in the upper arm. I've seen it a lot more in the back area here and also in the thigh. So we have our little fake patient here. What we're going to do first is we are going to put on our gloves. All right, so now that we have our gloves on, what we're gonna do is we are going to clean our top of our insulin bottle as well as the skin. So for the insulin bottle, we wanna do 15 seconds, and then skin is gonna be 30 seconds. I go in with a new alcohol pack, and we are going to scrub the skin. I start in the center and then I kind of work my way out so I'm not contaminating anything. And then you don't want to fan it, you don't want to blow, anything like that. So you just want to let the area dry for a minute before you go in and do the injection. Move our skin to the side, and what we're going to do is we're going to draw up our insulin. For the sake of this video, we're going to be drawing up a lot of insulin because I want you guys to be able to see it. Units are only used for insulin. Normally what they look like, maybe a little bit of different colors, but pretty tiny. I'm going to take off the bottom. I'm also going to take off the top. For the sake of this, I'm going to draw up 30 units. This is a ton of insulin. I'm going to pull back the plunger. This is the plunger of the syringe, okay? So I'm going to pull this back to 30 because that's how much I want to draw up. So here I pulled the plunger back again, which is this part right here. I pulled it back to 30 because I want to draw up 30 units. So in here I have 30 units of air. All right, I zoomed you guys in a little bit closer. So we have our 30 units of air. If we were drawing up 20 units, we would do 20 units of air. So whatever amount of insulin you're giving, that's how much air you want to pull up. And this goes for anything that you're kind of drawing up. So I'm going to insert this in like this. Before I flip over, what I'm going to do is I'm going to push the air into the bottle just like this. So I pushed it in. I'm going to flip upward like this, and then it should automatically start pulling it down. As you can see, it's slowly pulling it down. I'm going to give it a little bit of help since these are just practice needles and they have been used so much before with nursing school. So then what I'm going to do is I'm going to pull it out just like this. I'm gonna make sure that there's no air bubbles in the insulin. So tap, 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 make sure I'm getting all of them out. And with the tapping, what it will do is the bubbles will just kind of float up to the top and get out of there. So I like to make sure all of it's out. In my nursing program, we were taught to do insulin at a 90-degree angle, or depending on the amount of our patient's subcutaneous fat, that may vary. So instead of going straight down, if you have a very, very tiny patient, you're gonna go more at an angle to make sure that we get it into the subcutaneous layer and not the muscular layer. So we're gonna say our patient has enough subcutaneous fat where we can go in and just go straight at a 90-degree angle. Skin's clean, it's dry, and so what I'm gonna do is I'm just gonna do a slight pinch here, and I'm just going to do a little boop, just like that, and I'm gonna slowly inject the insulin in. Let go. Most needles will have like a safety cap that you can just slide up automatically before you put it in the sharps. Mine doesn't. I am going to take this immediately and put it into the sharps. And then our patient has our insulin, so we can take off our gloves and dispose of those. You may not necessarily see diabetics who receive insulin like this, but when you are in nursing school, you will be learning how to give insulin and draw it up from a vial and ampule like this. So you will have to know how to do that. It's so common nowadays for there to be so many alternatives than actually just drawing up the insulin. I love you guys.